Back in June, there was a weekly celebration where we all clapped for the NHS. But were we clapping for everyone employed by the service? It is not unusual for private companies to be contracted by the NHS. In fact, an estimated £15 billion worth of NHS contracts have been carried out by private firms since 2015. Indirect workers are technically NHS employees, yet they are often overshadowed in the media by frontline workers. Private companies still provide vital health services on behalf of the NHS, so why are some workers getting left out during the pandemic? I'm in Winchelsea to speak to Jo, a health worker carrying out NHS contracts in a private opticians. I ask her what it's like to be a forgotten worker.
You're still a frontline worker, but you weren't recognised as one, so we didn't get the privileges as others. It's been very difficult, and it's difficult to get the PPE equipment at first. We've had to buy our own PPE equipment, and we've not been reimbursed for it either.
During the rise of COVID-19, a number of help-out schemes were made to prioritise key health workers, but the emphasis was put on hospital and medical staff. This means that other NHS workers, like Jo, have missed out on priority shopping hours and free PPE equipment. Non-direct NHS staff are excluded from certain kinds of coverage, with less funding and recognition for their work in privately owned businesses, but this isn't because they are at a lower risk of infection. Back in May, optical health firms were in top groups for being most at risk of exposure to COVID-19. Out of 359 professions, optometry is ranked 17 for exposure to disease and 9th for close proximity to others. Jo explained that her work is a close contact job, having to be within inches or centimetres of people's faces, meaning she is at equal risk of contracting the virus as other health services. The government suggests that it is doing the best it can to help and protect NHS staff, stating, "We will continue to do everything we can to protect the NHS. And we will continue to protect the NHS and save both livelihoods and lives." Yet, a number of key health workers are still not being supported equally. Perhaps the year ahead will provide some much-needed changes.